This is Dr. Ken Kroll, addressing today the subject of cardiovascular disease. That means heart attacks and strokes and peripheral vascular disease. These are major issues in America today for reasons that I'll discuss very briefly today if you've got your paper and your pencils ready. Our crisis involves more than 50% of the reason that all of us are going to die, our cardiovascular crisis. We recall that on September the 11th, 9/11, 2,974 Americans died. A horrific event that led to America's entering the wars in Afghanistan and Iraq, with a loss of another estimated 6,000 Americans in 10 years of fighting. Yet on that same day, Tuesday, September the 11th, 2001, 2,500 Americans died of cardiovascular disease. And on Wednesday, another 2,500 died of the same cardiovascular disease, and again on Thursday and Friday and Saturday. In fact, in that month of September, 75,000 American deaths occurred from that one disease. And in 2001, 912,000 cardiovascular disease deaths were recorded for that 1 year. An interesting comparison is that in all the wars America has ever fought in its 200 years plus existence, 653,000 Americans died, far less than we lose in just 1 year from cardiovascular disease. And sadly, the cardiovascular death rate of close to 900,000 a year has repeated itself every year. And in just 3 days, cardiovascular disease claims more American lives than died in all 10 years fighting in Iraq and Afghanistan. And the disease can strike Americans at almost any age. One of my own surgery instructors, while I was training at University of California, died of a heart attack at age 39, just 1 week after a department barbecue he hosted at his home in Santa Ana. Joe was trim, muscular, 6 feet tall, who looked in great health. Another of my surgical instructors died of a heart attack a year later. He was 54. Another surprise, more women die each year from cardiovascular disease than do men. And cardiovascular disease in women will take 12 times more lives than will breast cancer. So let's start a discussion of this disease, its seemingly complexity of causes, its curious contradictions, why we've had so little success combating it, and what anti-aging science says we can do now to prevent it and even reverse it. Modern cardiology has amassed an impressive armada of treatments and procedures to combat this tsunami. A gold standard are coronary arteriograms that thread a small wire-guided catheter up the aorta and into the small arteries, providing blood to the heart, so we can visualize how much blockage has occurred from, quote, cardiovascular plaque, end quote. And when plaque obstruction is found, a decision is made that a stent can be placed to open a narrowed area, or if the blockage is severe and widespread, a triple or quadruple artery bypass procedure is performed, replacing the affected arteries with healthier vessels removed from other body areas. Presently in the United States, approximately 500,000 open chest artery bypass surgeries are performed annually, and 1 million angioplasty stents are placed. Also, a large proportion of America's adult population are on long-term statin drugs and blood thinners, in the belief that elevated cholesterol level and enhanced coagulation of blood are major culprits behind the disease. And recommendations are now being floated that all people of any age would benefit from being on statin drugs like Lipitor or Crestor, for example. Let me finish this discussion with my belief that much of how we view and manage this disease is seriously off base, and there are much better, much less costly, and less life-threatening answers available. So stay tuned for our next episode when I'm going to outline briefly the simple steps that you can take to not become victim of all these drugs and these surgeries and stents and blood thinners and things that have become a standard parts of our cardiology care.